like to invite Vrinda Mathur. Vrinda is a partner at Grant Thornton. She has over 13 years experience in advisory, due diligence, and corporate finance engagements in the healthcare sector. I'd also like to request our esteemed panelists to come on stage. Dr. Sam Mehta, Director and CEO, Mehta Hospitals. Mr. Sateesh Andra, Managing Director, Endiya Partners. Mr. Hari Thalapalli, CEO, Call Health. And Mr. Dileep Mangsuli, CTO, Wipro-GE Healthcare. A big hand for the panel team.
Can you hear me? Yeah. Okay. So thank you. It was a delicious meal, and I hope not too many of you are sleepy. We'll try and entertain you a bit. The esteemed panel has been introduced. What we had in mind and what we've been discussing is we have a few questions, certain questions which we've heard from you, and which we'd like to take up. We have about 40 minutes. Post 15-20 minutes of a couple of discussions that we've planned anyways, I think we'll open the floor for questions, and then we're happy to hear your thoughts, concerns, etc. You have a hospital operator, you have a couple of investors, you have a technology leader sitting here, so and somebody who looks at funding. So I think all of us should probably be able to answer some or all of your questions. So I'll probably begin. We've seen a lot of interesting ideas in the morning, and I know it'll pan out during the day as well. The title which we were discussing was technology, and I would like to ask Sateesh and Sam, you from a perspective of having invested in a lot of the ventures. How do you identify technology? When do you think it's ready? Is that a really tough decision? Do you wait it out, or it's instinctive and you realize, okay, this is something I would want to place my bet on, or encourage people to do that?
Yeah. So thanks for the opportunity. We're still learning. The honest answer is we're still learning. I think. Healthcare is a sector where you need to marry the domain with technology, just like financial services, because the most important thing is, technology is a means, not an end itself. We've had opportunity to invest in companies. Some of them have been successful, many of them have failed. I'll talk about a few of them. The latest investments, a company called Sigtable, which uses computer imaging in hematology, diagnostics, so where it's primarily complementing pathologists. So the role of technology in healthcare, to me, is really kind of assist, right, the decision maker as opposed to replace. That's never going to happen. And another investment in our current fund is a company called Celes. They're going after women's healthcare. They look at women and the entire life cycle of women, from general consultations to thyroid to any of these issues, nutrition, counseling, postmenopausal issues. So women have their own life cycle. So how do you address that? How do you reach out to people leveraging technology? Again, it's a combination of protocol plus use technology plus experts to be able to deliver that kind of service. And in the past, we've looked at companies like second opinion companies and chronic disease management, because chronic disease management, again, is a big area, just like hypertension or diabetes or whatever. We've also invested in medical devices companies. That's a big focus area for us, from low-cost medical ventilators to, many other devices. To me, I think net-net, it is really about, are you enabling access using technology? Are you obviously making decisions using technology and then kind of guiding the experts or complementing the experts? Or are these next generation devices, that are going to obviously disrupt? So we look at all these three categories. To me, I think a lot of stuff that's happening in India right now is on the access side, not so much on the disruption side. So And it's also, a kind of a full life cycle thing, right? If you really look at the overall landscape, you've got the tertiary care, and then you've got the specialized care, and then you have primary care, and then you have the preventive care, you have the nutrition. So when you look at it as a complete 360-degree view, obviously, tertiary care is a fairly established sector, and we've seen last decade, specialized care, whether it's dental, mother and child, eye, even dialysis, right, nephrology, that's all gone out. So now, if you really look at a lot of prevention, counseling, nutrition, and access is what is being kind of talked about. So in terms of to kind of really, give you a crisp answer, we're learning. I think we're watching, but we're pretty excited. The way I see it is just like telecom. We kind of leapfrog from 50 million fixed lines to, 800 million wireless phones. I think laggards leapfrog. So you've got all of this kind of coming together: mobility, big data, cloud, sensors. So by really leveraging all of this, I think you can reduce the cost and then you can give the access. So that's the excitement that we have.
Coming to access, Hari, I'll come to you in a minute, but you have, through the venture, increased, improved access, provided services that one couldn't think of. They are really available, whether at a click or over a phone call or through somebody's referral. Tell us a bit about the journey and what all you do. I'm sure it is so integrated that somebody somewhere might fit into it at any point of time.
Yeah, so again, thank you so much for the opportunity to be here. I run a company called Call Health. We are Hyderabad based. Now, there is a fundamental difference between what Call Health is trying to do and what I see across the healthcare ecosystem. What we are trying to do is to say that, is there a way we can change the way people will access healthcare going forward? The traditional methods that we have used have always been at two levels. One, very fragmented because each system is separate and they don't talk to each other, whether it is a lab or a pharmacy or a clinic or a hospital or so on. The data doesn't talk to each other. That's the first problem we have. The second problem is it is exceptionally doctor-centric, today's healthcare ecosystem. In other words, it's curative and doctor-centric. We are trying to fundamentally disrupt both those things. We are saying, can we integrate everything about health under one platform? And can we put the power of decision-making and access to the patient, not to the doctor? And doctor, therefore, kind of moves from the center of the ecosystem to one of the parts of the larger system. So that's what we are trying to do. So what we have set out to do is to say that 5 years from now, what Amazon and Flipkart and others did to the e-commerce side can Call Health do to the healthcare side. So we are across the whole dimension of prevention, wellness, cure, and care. We are across the dimension of B2C, B2B, B2B2C, and B2G in terms of who you are touching out, the demand layer. And we have created a platform which took us about 1,000 man-years of effort to put together what I would call as 3 stages of progress. First is the ability to land the basic services. Can somebody access a doctor at any time from anywhere, whether it is a doctor on the Call Health internal ecosystem or part of the external ecosystem? Can you help somebody to access the doctor? And the access to doctor, as you can see, can be at 3 levels. It's one-to-one, where I go for an episodic consultation. It could be one-to-many, where I have a doctor who is a general physician or a family doctor to the whole family. Or it could be many-to-one, where I have a second opinion and a third opinion for one issue that I'm dealing with. So we have enabled all 3 levels of connect possible on the platform. And of course, things like our logic has been, if anything can be done virtually, we should do virtually. There should be no reason for somebody to step out from wherever they are. The second point we kept in view was, if anything requires a physical touch and a contact, can we do it at home as much as possible before somebody has to really go to the tertiary care? And third, when there are going to be times in life when you cannot avoid but go to a hospital for an intervention or an aggressive treatment, can you facilitate and take the pain out of that whole thing? 45 minutes for check-in, 3 hours for discharge, insurance claim, and so on. Can you take all that pain out so that the person goes and checks in and checks out, just like a hotel check-in and check-out? So we have kind of done all of that into a single platform, which is the first phase of what Call Health is doing. The second phase, which we have already started, we are in our testing phase, is where we are saying, can we start integrating devices? And when I say devices, most of the minds will normally think of wearables. We are seeing wearables as the lowest level in the hierarchy of things. We are asking, can we do devices that will help provide investigative facility for the person on the ground where the doctor is somewhere else? Can I do a like say skin allergy? In today's context, it can never be done if you don't go to a doctor. But we are asking ourselves, can you have an equipment that can actually help the doctor see virtually what your problem is? We are currently doing dental investigations virtually. We are able to take it, show the level of problem. The doctor takes a decision saying, you need a root canal or you need a whatever, filling or whatever. That whole play, we are starting to move towards devices, which is the second phase. And we believe that the third phase, which is going to be 3 to 5 years from now, will be all about, can I do your medical history, your family history, your DNA mapping, and then decide predictive and proactive healthcare, which then you start moving to another place. But that's not now. That's going to be like really 3 to 5 years from now, and I'm being ambitious. It could be even longer. But the phase 1 and phase 2, we believe will happen. And what we have set out to do, therefore, in all this, is to create a platform that kind of decomposes every step or every action into a digital moment. So you're able to actually say, diagnostic report uploaded, that's a digital moment. Doctor gets an automatic alert saying report has been uploaded. Doctor makes the call to the patient, prescribes, that's a digital moment, goes back to the pharmacy, who in turn delivers the medicine. So the whole thing is integrated down. What we are setting out to do is to say, maybe going forward, the way people will access healthcare will not be the way we have done so far, which is very antiquated and very archaic. It hasn't changed over the years, and we are hoping that we can bring that change. So,
Sam, that
what
brings
Sateesh
me
said.
to you. You are part of a hospital, operating hospital. You're seeing newer technology. It sounds extremely disruptive. It's already taken its form in some way or the other. How many years do you think it'll take for us to be, for technology to be so fully integrated that the hospital is just going to be a very small leg of overall healthcare being provided in the country?
Yeah, so I can't really answer how long it will take. What I can say is clearly technology is increasing its mind share across health systems. I'm not sold that a hospital will be substituted. I think it will still represent a good 50% of all spend. And that is, today it's much higher. It will still represent the spend, right? So if you follow the money, you still want to be near a hospital. There's no substituting. You want to get born. Yeah, the concept of looking at a YouTube video and trying that at home is a good idea, but if you feel very comfortable with it, please put your hand up. Don't see any hands go up, right? You're safe, Sateesh. I'm sure you will have a different conversation with your daughters and your wife, right? But I think disruptions are happening. That being said, I think there's a behavior change that has to happen, and it's probably 1 or 2 generations worth of behavior change, right? When we invested in India Home Health, which at the time was, a great idea that rolled up into us by a good entrepreneur, Tyagarajan. He said that his wife wanted to start something, and I said, well, I don't really understand the space for diddly, but it sounds like a good conversation. We spent 4 months talking to each other, and I said, okay, I'll be your 50% partner. Right, and that was before really anybody was there except perhaps Nightingales. They were there at that time, but a small trust, unstructured guys. And there was an Apollo setup that was doing all sorts of things, unique home health, right? But really nobody structured. So in a space like that, that's obviously a consumer-centric business. So if you look at it from an investor side of view, when I look at consumer-centric business, it typically takes a significant amount of capital to move customer mindshare to you. Like in FMCG, you need a significant amount of capital. I don't even want to ask how much he's deploying, right? It sounds like a great idea. I'm sure QFIT, similar thing. When you talk in terms of consumer spaces, you're having to spend that money to get marketing up there, to build sufficient traction for virality, and I haven't really seen that much virality in work in India, to be honest. So the other piece is substitution is very high here. We are not wedded right, to that many things, except maybe a priest, a doctor, maybe the accountant for a couple of years, and a lawyer for a couple of events, right? And hopefully our spouses for a lot longer. That piece of India hopefully hasn't changed as much, but it's changing, right? So to me, I think the competitive intensity around a lot of these things are probably getting in each other's way, right? It's a little bit like a conversation saying, we're going to disrupt you, we're going to disrupt you. Great. I think we heard those 10 years ago, many of those guys have disappeared. So we've invested in healthcare since 91, right? But our hospitals have been there since 1933, right? We treat about a dozen patients that are over 100 years old. We passed 1 million births, right? Just put context, when people talk about startups, these are the places that have the startups. There is an emotional link. Yesterday, day before yesterday, and yesterday I was at a wedding, and 3 people I met came up to me and said, we were born in your hospital, right? And this is in another city, right? I think that physical touch cannot go, right? And I think if people think the physical touch can go, I can't see it. But that being said, from where I was 10 years ago, and we've all learned, a couple of scars show that, I think we've been successful because we've got healthcare exits. Perhaps very few people in this ecosystem have had the exits in healthcare. We've had 3 exits now, right? And we've not had a failure yet in healthcare. So therefore, we're more selective. But I think it comes down to really basic tacts, right? So if I'll give you an example today. We've been desperately looking to find an improvement for the patient-doctor experience in a hospital, right? So when I first looked at the HMS, HISs 8 years ago, and I've done this twice, so I've had 2 failures if I'm honest about it, because I always thought to myself these would be 10-year events. I'll have an HIS, I won't worry about it for 10 years, but I'm going to fail fast, right? And I come back to a basic premise, which is the doctor-patient experience in a hospital is actually a very painful experience for both parties, right? The doctor's in control, that's true, but actually the doctor's not in control. No, the doctor is not in control, right? He's got so many other things that are happening around him that the capacity to control that one experience and have predictability on the amount of time he can actually spend or she can actually spend on this person in front of them is not there, right? When they're in the IP setting, they don't know how many patients are waiting for them for surgery, yet they can look at it from how many are scheduled, but they don't know if the whole team has arrived. Those components aren't there. So very simple thing. When I started this, I used to say, I want something that is a nice computer that can manage my back office costs, ordering, reduce leakage in a hospital. Today, it's a very simple answer. I want somebody to come to me who will crack the 1-minute code for a doctor-patient experience, for the entire medical record on a mobile phone. I want the inpatient record done in 1 minute, so that for the remaining 9 to 14 minutes, the person is not doing information gathering before they walk into diagnostics or understanding the problem, right? The reality is today, of that 15 minutes, if you're lucky, or 10 minutes, or 9 minutes, which is actually the real answer, you're spending 6 minutes trying to find out what exactly is this guy sitting in front of me for, or this kid, right? That's not a healthy place to start. So answer it from the consumer side, but also from the ecosystem side is my preference to figuring out where I should be putting my money. Solve a real problem. India Home Health, why did I do it? Frankly, because my grandmother was going through a combination of post-surgical and then end of life, and putting nurses from my hospital into managing her was very painful. I used to manage when a nurse didn't come. What did we do when grandma wouldn't eat and threw the nurse out because she founded the hospital, right? So how can you say no to my grandma? But at some point in her life, she just didn't want to do that. But it was a real pain on the consumer face. So I think if you feel the pain, that makes sense to invest. If you understand where that pain is going to really solve, that makes sense. So B2B has historically been an interesting space, but it takes time for that market to develop. B2C just costs a lot of money in healthcare, if you ask me honestly. That's my take.
Coming to money, Dileep, with so much new technology coming in, relatively low-cost innovations, etc., where does it leave a very large capital-intensive product company like Wipro-GE? How are you coping with technology upgradations, and would there be a really small system here in the audience which could replace one of the very large machines that you manufacture, or could it simply be online on the phone?
Well, I think it's something that I actually like, that none of the things that technology does today is going to replace a doctor, first thing. And what we do, or what both of them are trying to do, are all trying to assist the doctor in one way or the other way. We create big irons, we call them like MR machine or CT machine, or all these are just assisting the doctors to make the decision. But coming to your point about how are we coping up with the technology advancement and also the affordability piece, this is becoming bigger and bigger globally. Two things happening. One is every big company has realized that their space in the market, which used to be the Western market, is not going to be sufficient for long-term sustenance. They are looking at the countries like Africa, Asia, and these are the countries where we see about 5.8 billion people who are underserved. And they can't really afford to pay for the treatment that costs today. I had a chance to interact with one of the doctors in a village about 600 kilometers from here. And he was buying an ultrasound machine, and asked him, like, he was trying to pick a machine which is going to do a fast scanning. And I asked, like, what makes you look for a machine which is fast scanner versus something which is going to give you a bigger results, better results? He said, look, when I get a patient, I do every day about 100 to 120 patients every day. It's only he and his wife who are gynecologists. And he said he does about 50 to 60 scans every day. And how much does he charge? He says anywhere between 200 to 300 rupees. And when it comes to a person who starts counting coins, he says, it's okay, I don't take the money. So he says that is the case. I cannot afford to have a machine which is going to be best in class, but I'm going to look at something which is going to give me good enough results. So can that be made at a affordable cost? And as a business, what we are trying to do is we have created a separate business unit. I think probably it is being done by every other business that's going to look at each one of these segments and how do we really look at the local needs and how do we generate something which is going to be right for them. One example was we worked with a partnership of a startup, Tricog, and we created a machine which is going to give instant results about your ECG. It was impossible. Like you give a ECG machine to a village. In a village, 90% of the doctors are quacks. Right? They don't understand what is that graph. It tells something. They just look through it, and they don't understand anything. So this partnership with the startup, and today I think if big companies need to really provide a solution or assistance to the doctors with the aids like machines and digital platforms, it can happen only with the partnerships. And I don't think any of the big companies will look at doing it on their own. Invention doesn't just happen there, invention happens everywhere. It is going to be a matter of time before alignment happens and partnerships happen, and the growth to really hit the markets here is going to happen.
Just one point on that, Vrinda. I think when we talk about technology, if it can eliminate the tyranny of time, distance, and cost, and eventually therefore provide convenience to the customer, any innovation or disruption is going to be caught up by the market. In today's context, when you have to go to a doctor who probably lives 3 kilometers away, but the travel time is judged by time, so it could be 40 minutes. If you can do that without the travel, people are going to like that. So the point, what you're saying, is that if you can eliminate the tyranny of time and distance and cost, a significant amount of connect or touch points will be taken up by the consumers. And I think that's the big thing. And no, I don't think anything that we do is going to be talking about replacing what is already there. It is about being able to complement the current situation in a way that it helps us access that service better and faster.
True. So you've heard, or some of us, we had a few topics that we basically wanted to introduce ourselves, but we want to leave the floor open for questions. Spend the next 20 minutes, so we could perhaps take 4 or 5 questions at the max, and probably one by one. If you could just get the mic to the audience.
Hello. My question is to Dr. Mehta. So I would like to ask, like you are telling that you want to improve the doctor-patient experience, right? But I believe when a patient comes to an hospital, the experience is all about the entire communication that happens between other professionals as well. So like how that can be improved by incorporating other professionals like nurses or other housekeeping staff or paramedics or allied health.
Yeah, I think you've hit it one, right? So the single biggest killer in a hospital is not what somebody walks in with. It's actually infection control globally, right? And to put context around it, infection control and medical negligence overcompensate in hospitals. And this is an American study. Forget, India doesn't have data yet. But in America, it's something like 30 or 40 times more dangerous to go into a hospital than to fly, right? Contextualizes. Most of you flew today and you probably got asked by your loved ones, how are you, safe flight. You don't necessarily get that when you go for an OPD or an IP, right? I think the nurse is actually probably the most critical ingredient in most of this, because they spend about 80% of the time with the consumer, making sure that their experience, their care is actually managed. So cure is a little bit more doctor, diagnostic is typically lab and imaging. You can argue a bit of cure you can give to the drug company, give some credit to them. There's no drug company sitting here, unfortunately. I think, so when we are talking about the 1-minute experience, my nurse experience, actually we're trialing a product that gives them a 40-second complete record, right? So today I have 2 heads of nursing sitting in all the evaluation for the technology, and I'm not wasting, escalating the technology. And we've seen in the last 2 months, 90 different tech companies, right? Just trying to solve this combination of the hospital information, hospital management system piece. The guys who have implemented successfully in Manipal, his previous place, Max, a whole bunch of other ecosystems, a couple of guys who've done it in the home healthcare domain, right? My gut says that people have to think really differently, right? A lot of people got excited by Dragon Speak Medical when it came out. It hasn't worked out. But if you can crack fundamental code of making that person's experience more efficient, right? I think you'll get code. We've got a technology that's being trialed in the hospital that's a wearable on every customer bed, right? And the idea for that is it tells the nurse when she should start getting excited and go to the patient, right? So it basically optimizes my nurse time. Now, coming to a question that was asked earlier around how deep the government should get involved in all this, frankly, I think the government should stay the hell out of the way, right? And the reality is, if you look at tech, it's in spite of the government. It's because they didn't understand that there was a tech industry growing, so they never paid attention. So it grew, right? To me, the government has historically gotten in the way of itself. It thought it was going to be a provider, right? It's not been a successful provider. You can see that by your spend figures. So now it's moving to more of a payer relationship, right? And it wants to be the big dada, which is tell everybody what prices are set. The free market should tell what free prices are set. If there was, as a suggestion came, if there was an open exchange of how much a service costed and people bid for that based on outcomes, I think that's a much better universe to share time in, right? So I think we will definitely get outcome-based medicine in our lifetime, preferably in the next 5 years if I live in hope, but I think pragmatically it'll be 15 years before that happens, because the insurance guys aren't chasing that. They're busy chasing volume, right? But the speed at which information currently flows between my lab and my doctor, today it's about a minute, right? So that was the HMR revision 1, the hospital management system, sorry, HMS revision 1. Today, I think you will start finding that 30 seconds with alerts, with the very good idea that came up was like a digital screen in front of a doctor, and for all their patients, it's like continuous news feed, right? The only thing is doctor anyway gets distracted. So you just added another dimension of distraction to them. But the idea is they know when a patient that's very critical has walked in. They know when a patient that's in their IP that's critical is getting treated. I think that's actually, these kind of simple techs will be in the short term more successful from an investment point of view as well as a market penetration point of view.
And also, I think there is, hospitals in the US, etc. They have designed mechanism to analyze patient outcomes, to have a point of contact when you enter a hospital and everything. The problem with us is we are dealing with volumes, but there are systems. There is ability and capability to be able to design systems to overcome that, but it's a factor of time.
So I just want to add on to that. There's a company called Outcome Health out of US. Take a look. They've done it fantastic. 85% of the market they've captured. What we've also seen is something called care plan. So you brought up a very good point. So when you go to a particular GP, who owns you, right? So there's a team that's coming together to deliver that particular service. And so it's just not doctor, it's physios and nurses and speech therapists, occupation therapists, whoever it is, nutritionists, counselors. So how do you really bring all of them together to deliver a particular care plan? So we are seeing how do you replace that physician assistant, right, who takes all the notes before a doctor comes and sees you. I think automation in that space is happening now.
So I had a question for Hari and maybe to the entire panel. So I would argue like the rise of these doctor consultation apps, it's a good thing. But from my personal experience, I feel like, especially with older patients, right, you need that FaceTime with the doctor, right? Like if my parents or somebody elderly goes to see the doctor, just the fact that you are face to face with the doctor is a huge, psychological component of feeling better. That especially if it's a family doctor that you've been seeing for a while. And my other quick point was around data. So Hari made a very important point that a lot of the data is in like these silos, right? Like I get a lot of places still have paper prescriptions. Even if you have digital prescriptions, like if I go to hospital X, I have a prescription from X. But let's say I move cities and go to hospital Y, they don't really accept that, right? Or you can't really transport all your medical. So I was just curious to hear from the whole panel about would the government regulating and making EMRs mandatory and make, more importantly, different EMRs talking to each other? Because that's another big problem. Like Manipal has an EMR, but it doesn't talk to anybody else. So would love to hear your thoughts on that.
So two things on this. The first point is on what you're referring to as the point of care and whether there can be a physical touch. So we have done an interesting play, even if I may say so myself. We kind of did a blend of high tech and high touch, as we call it. So the doctor stays in a virtual location. That doesn't change. But what we have done is have a mobile health officer, a nursing professional with about 3 to 5 years of experience, actually travel to the customer location from the nearest point of presence. And that person is that physical touch and contact to the patient. We have noticed actually with elderly people, the nursing professional gives a little bit more time and a little bit more understanding than a doctor. And we have noticed that he or she takes that 15 minutes to kind of have the initial conversations, capture the basic vitals, feed it into the system before they call the doctor. And they do a 5-minute briefing to the doctor or a 3-minute briefing to the doctor saying, this is the patient, this is the background. What we have noticed is that has helped a lot in terms of acceptance of this virtual mode of connect. If it was purely technology connect, I have a feeling it would have a little bit more reluctance. I was just mentioning to the team that over the last year and 3 months now, we have done about 55,000 consultations so far. So it's a fairly substantiated model in terms of what we see. I think it will work. And let's accept it, nursing professionals are available a lot more than doctors to go out and meet. Right? I have a doctor at home model, which we do for family doctor models, once a quarter. But it's still very difficult to get the doctors to move to a patient's home. It's not something that they would like to do. So that's one part of it. Coming to the other dimension of health, clearly interoperability of processes, of systems is a big challenge we are dealing with. Huge challenge. If I look at any other systems today, they don't have an HL7 integration play. I go to a lab, I go to a hospital. There are different levels of maturity. So now what we have done is we have categorized the associates that we work with. Associates meaning pharmacies, labs, clinics, hospitals, and ambulance providers, and so on and so forth, into 4 levels of maturity. And each one, there are some people who stand with an on-prem single PC to those who are connected 24/7 on the cloud. So you categorize them at different levels, and we are developing utilities that can help us go do a plug and play with these players. That's the next level of investment that we are making. But the truth is that that part of data integration and making EHR available to you on the move, while we may say we have done it, acceptance and receptivity to that is still very low, and we are struggling to bring about that change. But I know for a fact that with the government bringing in the NEHA, as they call it, the National E-Health Association, and so on, and they're bringing in some play around digitization of healthcare, I think it's only a question of time before it becomes an inevitable reality. Just like you see, the payment models, just like you see the unique numbers and so on, believe me, it's only a question of time before a standardized EMR and a platform will come into this country. And I think it's just going to be a question of who's ready to plug and play faster. But that's my perspective. Obviously, I'm a guy who's running a company. It's in my interest to hope so.
Hello. Sir, this is Jagan here. This is Jagan. See, I'm happy to see that health tech is advancing and the lifespan of a person is increasing. The other side, the population is increasing enormously. The resources are depleting. So, I mean, total conflict and contrast. So, any answers?
I'm just going to give one 1-minute answer and then hand it over to the others. Let's accept that today, 70% of the illnesses that people face are lifestyle related or communicable diseases related. Okay, about 70% of that. 70% of the doctors that are available in the country are available in tier 1 cities. And like what Sam said, in today's context, 70% of healthcare spend is around preventive and curative play. Not necessarily the surgery and aggressive IP and OT play. So the point to look at is, if you can manage to capture the illnesses or prevent the illnesses, we'll be better off as a country, irrespective of what the size of the population is and so on. The question truly is, can companies like YourFit and others bring forth a greater awareness to prevention and wellness than just the curative aspect? And I think the youth of India today are a little bit more receptive to that play. But it's a long haul game.
I think, to that point, there are a couple of things. One is, you don't have answer to that particular issue of, growing population, how do you manage that? But this thing that is going to change is the way the disease is managed, the way the detection is managed, that's going to change. The FaceTime, whether it is a virtual FaceTime or an actual FaceTime, is going to remain same. Like if a doctor has to see a patient, if he has to see at least 5 minutes or 10 minutes, even though he is doing it on a mobile phone or physical, that time is not going to change. So that means your requirement of experts is still continuing to increase, and government will be focusing on that. But what's going to change is, how does a doctor make a decision faster with the digital means is something that is going to really compress the overall time one takes. I think that is the only answer I can see here. I don't see anything else.
It's true, point of care, right? So a lot of the point of care, the reason why point of care started taking off is a emergency doctor or a person sitting in a, let's say, tier 3 location is able to get an instant answer without sending it to the lab. right? That's why that space is taken off much quicker in some areas versus the guys who are saying, I'll do 100 tests, but you have to send the test kit in and the assay in. Those I think are not really going to stick out. But things that help the person take a decision quicker to save lives. And a couple of good guys, the IMI Health guys have done some interesting stuff, and guys like that. So I think there are folks like that.
Yeah, in fact, no, last week we had one of the doctor who visited our center, and she was saying she faces every day one or other problem where she's not able to make a decision as to what I should do on this particular critical care. And she's doing a scan and she sees a problem, but if she has to send this patient to a hospital which is a better hospital with a better care, it's 150 kilometers away. She says, I can't send the patient away. Can you guys think of doing something which instantly is able to translate what I'm seeing here, another expert sees there? So how can you create more eyes for the same expertise? I think those are the things that are going to change the way we operate on these, healthcare.
And answering your question about population, I've visited a civil hospital in Bolpur near Calcutta. The number of people waiting outside the hospital is tremendous. The number of doctors inside is very few. But there is also technology. There are a few private providers, etc., who are integrating with that very hospital to bring in technology so that this particular patient can get access somewhere else, or let's say in a larger hospital. So it'll happen. I mean, population is a problem we have to sort of deal with. But over a period of time, I think we'll be able to bridge the gap a bit, if not fully.
Nowadays, if you take, water is not there for everybody. As the population grows, it's very difficult for people to get some drinking water. So that way, I'm asking. Survival, yes.
So there's a waterless toilet that's currently being tracked. We're trying to put one in our hospital, but unfortunately, it's not one with the greatest of smell. So the cost of managing the, I guess, per procedure, right, for lack of another word, is actually a little bit painful, because you will have to obviously perfume the area, which may defeat the object in the first place of that. So technology will play a role, right? And it has to. But at the end of the day, human nature will also self-correct, right? People emigrate when they end up in a place where they haven't, some of you guys don't remember it, but a lot of Indians emigrated. I mean, one side of my family went through Africa, right? East Africa into other parts of the world. So that will happen. Maybe this, the flight to Mars will become much cheaper and we'll all become space explorers.
Maybe you'll be able to drink seawater one day and we'll be able to treat it.
I want to suggest, there's a book called Abundance. I don't know if you have had a chance to read it. If not, I would strongly recommend that you should read that book called Abundance. Yeah, that is enough for everyone, believe me. While there are, of course, challenges we deal with, I think we live in a world where technology has been finding solutions to most of our problems, and those are not.
Maybe a question from the right-hand side. You guys don't seem to be asking any questions.
Hi.
Yeah.
Hi. Sorry, I have this mic and I've been waiting to ask a very basic and yeah. So a very basic and conflicting issue I have, because I am dealing day in, day night for my venture with gynecologists. And when we talk about the entire digitization and helping them and adding to it, the basic question is that Indian market is not just fragmented, it's very unevenly distributed as well. And the ratio of doctor versus patient is very, very low. So if we say that we are creating a virtual world, on one hand, we are talking about somebody from the remote area who does not have access because of the unevenly distribution, is going to talk to the doctor sitting somewhere in the city maybe, and but then again, the doctor who already has so many patients waiting in queue and who they're not able to provide the care satisfaction, basically, how they're going to take out time to to be able to treat the patients virtually cause we are adding up pressure to their existing work. Already they have too many things in their hands to do, because they have to run their business, they have to look after their patient. And secondly, the people what we are talking about, they're in certain remote location, are they capable of using those technology? So there's a demand and supply conflict I see here. So I just wanted to understand on that mode, because I really agree with the patient customer engagement, because we are working in that same segment. We need to take the work off the doctor's plate with help of technology.
Okay, so I hope I don't sound like I have answers to all the questions, but I have a couple of points to make on this, and this is very important. I'm glad you brought it up. I have always categorized in the last, so I'm a pure play technology services guy who happened to move into healthcare 2.5 years ago. So I can tell you that I see the issue from the outside without any burden or any stress of previous knowledge. If you look at the doctors, you could categorize them into celebrity doctors who have 100, 120 people waiting outside, and then you have a lot of doctors who don't have that load. We all know that. What makes a celebrity doctor is the fact that he or she is very sharp at diagnosis and come up with probably a more precise assessment of what your problem is and an ability to resolve. That's what causes them. And then after some time, it's the brand that picks up more and more and more, right? What we believe we need to do, and we have built a clinical decision support system, and I can tell you that there are many others who are doing the same thing. We have built a CDSS which is kind of doing it at 4 levels today, which we believe will help even a not so popular doctor get to a more sharper diagnosis on the issue. We have a differential diagnosis that captures from symptoms to disease, from disease to diagnostics, which is to what kind of test should you do for this. Because there are maybe 10 tests that you can do, but the question is, given these symptoms, which test is best suited for that? Then from diagnostics to drugs, which is as therefore what kind of medicines would you prefer if it's a positive one, and then what we call as a drugs to drugs thing. You already are hypertensive, you already are diabetic, can you have this medicine or not? So we have kind of built a clinical decision system that kind of connects at 4 levels. Currently the first 2 are already in operation, the other 2 are in testing phase, and we have compared it with the likes of Mayo Clinic and Isabel Symptom Checker, and I can see that we are currently ranked number 2 across 20 frameworks that we tested it on. Now the point is this, if you are able to get a doctor, get to a sharper diagnosis in terms of your issue, chances are you will, like what Thomas Friedman said at one point of time, you could make it a kind of a flat world, meaning a doctor in Nagpur could be as popular as a doctor in Hyderabad, and it can get there. Nothing ill of Nagpur, but I'm just saying somebody in a tier 2 town or a tier 3 town can be as popular as somebody else. Now, I believe that that's what will happen as we go along. You're starting to see too many of these tools being built. Chances are you will have some level of sharper diagnosis tools that will come into play. That's the first point. The second point is, I currently am talking to one of our biggest Bollywood heroes, who has a CSR foundation that focuses on health and hygiene and education. We are working with him to take the Call Health Lounge, as we call it, to the interiors in India, to a few villages which he has adopted. The idea is that those will be populated by locally trained professionals or a planted professional. And he or she will help do that. So in the case of a village, you may not go home, but they will come to the equivalent of a health center or a health lounge, and you will do that. Do not underestimate the power of the Indian population, or for that matter, the global population, to adopt the technology. They have done it already and they have shown it possible. You just have to make it easy so that they can then access whoever. Now, the point I'm trying to make is, some of these changes are not going to happen overnight. There is going to be a lifetime, there is going to be a long tail and a runway to that. But the truth is the change has begun and it is irreversible. And it will happen. I believe earlier I used to get maybe 2 to 3 doctors a month who are willing to roster onto our platform in a month. Now I get them on an average 7 to 10 doctors who are reaching out to us saying, can I get onto your platform in a week? So I'm saying the adoption has started and it'll pick up from there.
So we're a little short on time. There's a next speaker who's waiting to come and share some thoughts with you. So we'll, okay.